This is the setup of an intermittent urinary catheter or indwelling catheter insertion for males and females. Verify the orders for catheter placement. Gather the needed supplies. You may want to bring an extra set of catheter insertion and an extra pair of sterile gloves if needed to replace. Complete the 6 essential tasks. Ensure good lighting in the room. If you are right-handed, work on the right side of the bed. If you are left-handed, work on the left side of the bed. Place the patient into a dorsal recumbent position. Ask the patient to flex their knees and place their feet flat on the bed. Instruct the patient to relax their thighs and allow them to rotate externally. If the patient is confused or unable to follow directions, obtain help. Drape the patient, covering the upper body with a blanket, exposing the perineal area. Don clean gloves. Position the procedure light for optimal visualization of the perineum, then locate the urinary meatus. Complete perineal care. Allow to dry. Remove your gloves and perform hand hygiene. Organize the work area. Arrange the bedside table within reach. Open the sterile catheter kit sleeve and place on the bedside table without contaminating the inside wrap. Position a plastic bag or trash receptacle so you do not have to reach across the sterile field. Open the catheter kit, away from you, then open the 2 sides, and lastly the side closest to you. You can touch the 1-inch border of the catheter kit, but nothing beyond that. Applying the sterile underpad and drape. There are 2 different ways to do this, and it will depend on what kind of catheter kit you have at your facility. The 2 variations are whether the sterile gloves are packed on the top of the kit or the sterile underpad is packed on the top of the kit. First, we will discuss when the sterile gloves are packed on the top of the kit. Once you've opened the sterile catheter kit, remove the sterile glove package from the kit. Don sterile gloves. Grasp the edges and edge down, making a cuff to protect the gloves. With the shiny side down, ask the patient to raise their hips if they are able, or slide the drape under the patient's buttocks without contaminating the gloves. Then pick up the drape with the opening in the middle. Place this over the perineum with the labia or penis exposed through the hole. These 2 drapes allow for an expanded sterile area. The other variation is if the sterile underpad is packed as the top item in the kit. Remove the sterile underpad from the kit before donning sterile gloves. Do not touch any other items in the kit with the bare hands. Allow the drape to fall open, touching only the corners and the shiny side. Place the drape shiny side down under the patient's buttocks. Then carefully remove the sterile glove package. Don sterile gloves. Pick up the drape with the opening in the middle. Place over the perineum with the labia or penis exposed through the hole. Now we will organize the kit on the sterile field and prepare the supplies within the kit. maintaining sterility. Open the antiseptic packet. Pour the solution over the cotton balls. Some kits will come with swab sticks. If so, open the packet at the stick end. You may also take out all 3 swab sticks if you choose and place them in the sterile kit. Place the forceps near the cotton balls if you are using them. Open the specimen container if a specimen is to be collected. Remove any unneeded supplies from the field. Remove the plastic wrapper from the kit if covered. Squeeze the sterile lubricant into the kit tray, rolling the catheter tip in the lubricant, 1 to 2 inches for the females and 5 to 7 inches for males. Attach the sterile water-filled syringe to the balloon port of the catheter. Leave this attached. Touching only the kit or the inside wrapping, place the sterile catheter kit down onto the sterile field between the patient's legs. Now we will complete catheter prep for female insertion. Place the non-dominant hand above the labia. Spread the labia apart, pulling up using the thumb and forefinger or forefinger and middle finger. Use firm pressure to hold this position throughout the procedure. If the labia accidentally slips over the meatus during cleansing, repeat the procedure. Continue to spread the labia with the non-dominant hand. Hold the forceps in a dominant hand and pick up a cotton ball. Wipe in the following order: inside far labium minora, inside nearest labium minora, then down the center of the urinary meatus. So that will be the farthest away from you, the closest to you, and down the center. Use only 1 stroke and a new cotton ball for each area. Discard of the cotton balls or swabs as they are used. Do not move them across the open sterile field. Simply just drop them into the trash can next to you. You do not want to move your hands lower than your waist or you will lose sterility. With the dominant hand, hold the catheter 2 to 3 inches from the tip, with the remainder of the catheter coiled in the palm of your hand. If the catheter touches the labia or unsterile items, or it is placed into the vagina, obtain and insert a new sterile catheter. Ask the patient to bear down, as trying to void. Insert the catheter into the meatus. Instruct the patient to take slow, deep breaths. Continue gentle insertion of the catheter until urine flows. Then insert another 1 to 2 inches. If resistance is felt, withdraw the catheter. Do not force. After urine flows, stabilize the catheter's position in the urethra with the non-dominant hand. Use the dominant hand to pick up the sterile water-filled syringe and inflate the catheter balloon. If the patient complains of pain upon the balloon inflation, use the syringe to withdraw water from the balloon and advance the catheter 1 inch further, then reinflate. Ensure you have used all 10 milliliters of the water in the syringe. After the balloon is inflated, pull back gently on the catheter until resistance is felt. Connect the drainage bag at the end of the catheter, if not already pre-connected. Hang the drainage bag to the side of the bed below the level of the bladder. Make sure you are hanging the catheter bag to a non-movable part of the bed. Use a catheter securement device to secure the catheter to the thigh. Clean the perineal area as needed and allow to dry. Discard supplies in a biohazard receptacle. Remove gloves and complete the ending 4 tasks. Now we will complete male urinary indwelling catheter insertion. With the non-dominant hand, grasp the penis without contaminating the surrounding drape. Retract the foreskin if uncircumcised. Hold the penis at a 90-degree angle to the body. Continue holding the penis with the non-dominant hand, holding the forceps in the dominant hand, and picking up a cotton ball. Clean in circular motions, starting at the meatus and working partially down the shaft of the penis. Repeat with at least 2 more cotton balls or swabs. Discard the cotton balls and swabs as they are used without contaminating the sterile field, making sure to just drop them in the trash can next to you and not lowering your hands below your waist. Use the dominant hand, holding the catheter 2 to 3 inches from the tip, with the remainder of the catheter coiled in the palm of the hand. Continue to hold the penis at a 90-degree angle to the body with the non-dominant hand. Ask the patient to bear down as though they are trying to void. Slowly insert the catheter into the meatus. Instruct the patient to take slow, deep breaths. Continue insertion until urine flows, then advance almost to the bifurcation or the Y connector piece of the catheter. Stabilize the catheter's position with the non-dominant hand. Use the dominant hand to pick up the sterile-filled water syringe and inflate the catheter balloon. Make sure you inflate all 10 milliliters. If the patient complains of pain upon balloon inflation, use the syringe to withdraw water from the balloon and advance the catheter 1 inch further, then reinflate. After the balloon is inflated, pull back on the catheter gently until resistance is felt. Connect the drainage bag to the end of the catheter if not already pre-connected. Hang the drainage bag to the side of the bed below the level of the bladder. Make sure to hang the bag to a non-movable part of the bed. Secure a catheter securement device to the thigh. Clean the perineal area as needed and allow to dry. Discard supplies in a biohazard receptacle. Remove gloves and complete the ending 4 tasks.
All right, we are going to take a catheter out now. We've gotten an order to discontinue. We have done all of our 6 initial steps, and I have my supplies here. I have my clean gloves. I have a syringe to deflate the balloon, and I have a washcloth to put below the peri area, and actually I'll put my gloves on before I do that. I have explained to them what I'm doing. I'm putting this is to protect your sheets because you will have dribble follow. If there's urine here, you're going to make sure we put the rest of it in the bag. So unhooking our holder here. And there's all kinds of different holders out there. I didn't have a holder, so I just used 2 pieces of tape. And now I am going to make sure I empty all of the urine that might be in the coils into the collection bag, and I will measure that at the end. So, taking my syringe. I will also want to note on the catheter, it usually says how many milliliters. This was a 14 French, 10 milliliter solution. So I know I need a catheter or a syringe that's at least 10 milliliters. Take the cap off and twist that on. And you're going to empty the balloon. It might not start initially, but you're going to help it a little bit. And you're going to inform your patient just to relax. They shouldn't feel anything. Making sure we pull back until we might see a bubble. We have no more fluid coming out. That means that balloon is empty. And then this, we're going to slowly pull this out. We want to make sure the tip is intact. Wrap this up, and we can actually dry our patient. We can do some pericare as well, and we would reposition our patient, put the bed down for safety, and we would go measure, document, and dispose of our supplies. I'm going to take off my gloves and wash my hands.